Okay. Did anyone go to the International Arts Festival this weekend that I had on campus here? Oh, it was pretty good. Okay. So obviously you're getting your Scantrons back. And in case you didn't know, the score you get, the number you get correct out of 50 is that top number that you see. And then I multiply that by 3, and that's the score that you see posted here. All right, so that's how I come up with that number. No one's asked yet except for one person. But yeah, you guys really did well, 84%. That's the highest exam percent score that we've had all semester. So nice job. Okay, so that means we've got one lecture quiz coming up, and that's going to be on respiratory stuff. The final exam, which is posted on the syllabus, and I'm still working. I took the weekend off, to be honest with you. I needed the break, but I'm going to be grading those case studies and those lab reports. And so you'll be getting case study score, and then you can go through all of these scores and basically cross off the lowest one, which is what I will do on this. And then, of course, your second lab report. The last date for this bonus thing, I have as tomorrow, but I've changed things up because normally I was going to hand off all the stuff that we raised to this guy when he comes to talk, but I'm actually going to push it off to this Thursday. So Friday, the boxes will be gone this Friday. Okay. So we actually have until, well, Thursday is 14th. Okay. And then on the 15th, we're taking all the boxes up. Okay. And yeah, that's what we've got left. All right. I'm going to finish the kidney chapter. I've only got a few slides to go here. And then starting immune physiology today. And then the last chapter be reproductive physiology. And that's it. 2 chapters to go. You're almost there, right? So it's exciting, kind of terrifying. All right. Any questions about all that stuff? You almost made it through physiology. Almost. So close. All right. So kidney stuff. Get off the screen. Here we go. I think we left off here, but I can't remember. I remember talking about it. So did we cover this already? Talked about urinary stones, talked about the danger of them, talked about blockage of urine flow that can destroy kidneys, and that kidney stones or urinary stones are really sharp, the crystals. And as they pass through the urinary tract, they will scratch and rake. And that's what the bleeding that sometimes you see cause when it passes through the urethra. Okay, so you're going to see it's very common. So moving on, if it will let me. So there's the clinical app on it. Basically, everything I said can be all kinds of different crystals. Now, here's the thing. Has anyone ever seen this done? I've seen it done on animals, but of course, it didn't work with people. You can insert a Foley catheter. We've talked about that before. And you can have a solution that will help break up those crystals and dissolve them, because acidic solutions make the crystals dissolve. And that's one way to do them if they're in the bladder, okay? Another thing that can be done, if it's really bad, like I've seen dogs where it just fills up the entire bladder, you have to surgically get that big stone out. But also shockwave lithotripsy. They use kind of like an ultrasound device to physically break up the crystals so they're small enough that they can be passed. Has anyone ever heard of that or actually seen it? Because every semester I have students who volunteer or shadow different places, and I knew a student who said, oh yeah, I've seen that. No? Okay, well, as nurses, you will see that because these are very common ways to get rid of crystals. A dietary change can also do it. If you take on a diet so that your blood pH and your pH of your urine is not so alkaline, it's more acidic, that seems to help too. Okay, polycystic kidney disease, not as common as urinary stones, but when we get to the reproductive system, we're going to talk about polycystic ovarian syndrome, which some of you might have heard of because it's very common. And you get these fluid-filled cysts that build up. And this can happen in the kidneys. It's something different, polycystic kidney disease, autosomal dominant inherited. That means you only have to inherit one copy of the gene, either from your mom or your dad, and you're going to express it. So it's common enough. And those fluid-filled cysts is fluid trapped in the confined space, and it causes pressure, and the pressure moves out into soft tissue. In this case, is the kidneys, And you can have the kidneys destroyed by what's called pressure necrosis from all of these cysts, fluid-filled cysts. Obviously, these are kidneys. I mean, they're huge. These kidneys, the kidneys are not supposed to be this big, right? In anatomy, you kind of looked at human kidneys. These are very diseased kidneys that had to be removed. I don't know if the person got a kidney transplant or they died of this disease, but you can see all the fluid-filled sacs and the kidneys just become mush, which is what would happen left untreated. All right, so you might see that. You might see that. Dialysis, I could go on forever, but we have several dialysis units around Florence that are associated with either McLeod or MUSC. Anyone know someone who undergoes kidney dialysis because their kidneys are no longer functioning at filtering the blood anymore, or at least not sufficiently? Okay, someone in your family or just someone you know? And when they go in, I don't know if you know the details, it's a long day, isn't it? And they go in how? And they go in how often in a week?
Recently was less and actually got a kidney. He's doing great. But I think he had to go like 3-4 times a week.
Yep.
Because it was really bad.
So 3-4 times a week, like I told you before, you're not going to survive more than a day or two without functioning kidneys or dialysis. So that's why they have to go that often, because in a day or so's time, those toxins are building up in their bloodstream and can affect all your body's organs, and not filtered out, those organs are going to shut down, and multi-organ system shutdown, which is pretty bad. But anyway, so they're taking your blood, passing it through, let's just say, complex filtration system that filters out the toxins. And I don't know if it retains glucose. I don't know those details, but it's also known as renal replacement therapy. And as you just heard, 3 or 4 times a day, depending on your kidney function. And it's an all-day event. So this consumes a person who's on dialysis pretty much their entire life while they're just getting kidney dialysis done. But it's life-saving. You got to do it or you're not going to make it. So I'm really happy to hear that person got a kidney. That's awesome. So dialysis refers to the separation of molecules using ability to diffuse across an artificial semi-permeable membrane. The lab where we use the dialysis tubing, but that's very simple tubing. This stuff is medical grade, more complicated. So diffusion, all right, what's on high on one side of that membrane and low on the other. So if there's toxins, they're going to diffuse across and be removed. Just like the walls of glomerular capillaries, all right, there's diffusion and of course filtration going on. However, unlike our nephron tubules, the artificial membrane can't reabsorb sodium and potassium. Glucose, there's the answer, I just forgot. And other molecules that normally the proximal convoluted tubule will allow reabsorption of all those valuable things back into the bloodstream. When you go through dialysis, you're losing those. So obviously those have to be supplemented and given to the patient because that's a big source of loss for them. Now this is interesting. Sometimes the patient's own peritoneal membranes, which line the abdominal cavity, are used in dialysis. I'm not so familiar with this, but obviously I'm sure it's gotten even better since then. But for patients whose kidneys are just, they're done. And by the way, COVID patients, they go through a lot. And a lot of them that are going through bad response to COVID end up on dialysis because their kidneys shut down. I don't know how the virus is doing that, but I do know that patients that ended up intubated very rarely came off intubation and ended up really dying from kidney failure. So there's some sort of connection there. Okay, and this is going to be basically the last slide. Now, in pharmacology and nursing, you're going to learn so many drugs that are diuretics. And there's more than I've got here. I've just got the big groups. And under these groups, there's all these different variations. So carbonic anhydrase inhibitors, like acetazolamide is an example, the common one. Loop diuretics. This is one of the first diuretics ever designed by a lab. And it's known as Lasix, is the brand name. And then its active ingredient is furosemide. So if you've ever heard of that, have a relative on the water pill. And then thiazides are more recent, like hydrochlorothiazide. Now, I list these 3 because they all act the same way, and they act on different parts of the nephron. And fortunately, the way I've listed it, alphabetical it matches where in the nephron they act. So C comes first in the alphabet. These decrease salt retention at the proximal convoluted tubule. So that's the first part of the nephron. Here's what's happening. Water follows salt wherever it goes. Water follows sugar too. So normally at the proximal convoluted tubule, pretty much everything is getting reabsorbed back into the bloodstream. Salts, glucose, small amino acids, lots and lots of water, and that goes right back into your circulation. If you're reabsorbing salt, which happens here, you reabsorb water into your bloodstream, okay? And we all know that when you're retaining water, because you're retaining salt, that can make your blood pressure go up. But for young, healthy people, no problem. But for people with chronic hypertension, that is a problem. And so one way to lower your blood pressure is to get you to pee that body water out by moving salt out in your urine. So by preventing salt retention going back into your bloodstream, it prevents it from happening here. And so the salt remains in the filtrate in the nephron, and it leaves out in your urine, and water is going to follow that salt out in your urine. And by peeing out body water, your blood volume goes down and your blood pressure goes down. And so that's what the water pills are designed to do, is make you pee a lot so you lose body water. It happens by moving salt first. And they all work the same way. Now there's some subtleties, and you'll learn it in pharmacology, but that's the basic way they work. Loop diuretics work on the loop of Henle. Now, quick little test. So I covered this last time. Which side of the loop, the descending or the ascending, allows salt to pass but not water? Because they're doing the opposite of each other, the two different sides of the loop. Can you remember? The ascending side, okay? This side only allows water out but not salt. This allows salt out but not water. And I explained in terms of how your urine gets concentrated. So normally salt will be pulled out of the ascending loop of Henle, and that pulls water out here, allowing you to concentrate your urine. If you want that water to stay in the filtrate to pee it out, you prevent salt from leaving the ascending loop. And so that gets out in your urine, and the water stays in the filtrate following that salt out in your urine, and you pee out body water, drop your blood pressure. And then thiazides, T comes last in the alphabet here, that's working on preventing salt retention at the distal convoluted tubule. So you'll pee out salt and pee out water. So they're all doing the same thing. Now, I'm not going to test you on the clinical app that I have following this, but it gets more complicated. But you just know these classes, know where they act on the nephron and how they're acting. Don't retain salt, pee it out. That makes you pee out water, and that's going to lower your blood pressure. So we've talked a lot this semester, because of the big three, of how you regulate blood pressure. We just tested either exam 2, the drugs. I think this was third exam was the drugs. We've talked about sodium and calcium channel blockers. We've talked about beta-1 adrenergic blockers. We've talked about ACE inhibitors, all right, affecting what's going on in the lungs, which affects your blood pressure. And now we're talking about drugs that affect the nephron to lower your blood pressure. There's all these different ways to come at high blood pressure, because not everyone's going to respond to a drug the same way. So they got all these different ways of doing it. You're going to have fun in pharmacology. Okay. So diuretic is a substance that increases urine volume, your pee out body water, to dilute the blood's plasma, lower its osmolarity. Don't worry about that. That's too complicated. But let's go on to something that's more clinically relevant. Okay. The most powerful clinical diuretics are the loop diuretics, like Lasix, inhibit as much as 25%. Go to the next one. Come on. There we go. Of the salt transport out of the ascending loop of Henle. That's a lot. Very effective. Okay. The thiazides, this is where they're good and they're most recently developed, but they've got some complications. Block salt and water retention by inhibiting sodium transport in the last part of the distal convoluted tubule. Lasix and hydrochlorothiazide have an undesirable side effect. Now, I don't know if you remember back when I talked about cell transport and I talked about sodium, wherever sodium goes, potassium tends to go in the opposite direction. And I think I talked about it with disorders of aldosterone. Okay. And I don't know why it is that, but if you're peeing out sodium, you're probably going to be retaining potassium, or there's going to be some upset with your potassium. So These two diuretics have an undesirable side effect. They promote the excretion of potassium. Here we're losing potassium. Some allow you to retain it. So hypokalemia can cause neuromuscular disorders, heart disorders. And then people taking these diuretics should get their blood potassium monitored. So if people are on these diuretics and they're on them for a while, they might be on them for a lifetime, and they come in for a recheck with you, you're going to want to check their history of what's happening with their blood potassium. And then that's important because messing with your potassium will ultimately mess with your heart. But this is just extra stuff. I'm not asking you to memorize that. I just want you to know the 3 classes of diuretics and where they act in the nephron and yeah, their mechanism of action. So that ends the kidney chapter. So I'll post that today after lecture. Any questions about any of this material before I move on to the immune system? Okay. All right. Bless you. Now, I might have asked this before, but at this point it becomes a blur and I can't remember what I asked and what I didn't ask because the semester's running, screeching to a halt. How many people in anatomy covered the immune system, like where the main immune cells or organs are located in the body? Maybe the lymphatic system. Anyone cover lymphatic system? A little bit. Okay. Basically, the lymphatic system is a place where your immune cells can be matured and transported around your body. And the lymphatic system also functions to retrieve any fluids that have leaked out of your cardiovascular system to your blood vessels, and it gets into your tissue. Your lymph system is supposed to remove that fluid from your tissues and get it back into circulation. When people have problems with their lymph nodes, really relevant to nursing, okay? I know this from being a breast cancer survivor. I was fortunate that I didn't have to have any active lymph nodes removed, because cancer, once it gets into your lymph nodes, it's on the highway through your body and it's going to spread, okay? And people who have had lymph nodes removed in their armpit area, if you ever have a breast cancer patient come in, and it's not on their patient history, it should be, ask them if you know they had breast cancer and everything like that. Did you ever have lymph nodes removed from your armpit region? And if they did, and you know which side, or they know which side, you cannot put a blood pressure cuff on that arm. Do you know why? You could trigger an event to happen in the lymphatic system where they get swelling of that arm and it might not go away. All right. So your lymph system, you're part of your immune system. You'll learn all that stuff in nursing. So we'll quickly review some immune organs and cells. And then the big thing is to go through the 2 categories of immunity. So now that we've lived through, I'm not convinced it's done yet, COVID, I think it'll be back next year, hopefully to be mutated to where it's still, people are still catching it, but now it's become more like a flu as opposed to you're hospitalized and on a ventilator. Innate versus adaptive. People who got the vaccine, they did that so that the body would form adaptive or antibody-mediated immunity. You produce antibodies against that virus to, when you're exposed, your immune system's primed and pumped and ready to go. And that's why a lot of them were a second set of vaccines, and then they even promoted a third, and now they're even thinking about a fourth. Well, anyway, we'll talk about why that's important and why it's done that way. And then we'll definitely talk about T cells and B cells, and then we'll end with natural versus artificial immunity and cover a few autoimmune disorders that we've covered throughout the semester. Okay, so quick anatomy review. Where your immune system lives, all right? The big thing is the bone marrow. Bone marrow are where all your blood cells are produced. That includes red blood cells, platelets or thrombocytes, and lymphocytes, all right? All your white blood cells, in fact, not just lymphocytes. So you remember the mnemonic, never let monkeys eat bananas? We had the blood lab, all right? We're gonna be spending time talking about the lymphocytes specifically. Your appendix, which is that little dangly things that hangs off the first part of your large intestine, the cecum, supposed to play an immune function, although you can live without it. And it often is removed in people because, well, this, your colon contains bacteria. It's usually the good bacteria that outcompete the bad bacteria, but there's bacteria there. And for some people, for whatever reason, with gravity, bacteria can cause an infection, appendicitis, and then you got to go remove that thing before the thing ruptures into your abdominal cavity. All right. Okay. Lymph nodes throughout your whole body. We've got a lot of them in our intestines that are called Peyer's patches. Think about your intestines. You're consuming the environment. It's passing through your body. You extract all the goodies and get rid of the waste. What happens if you consume a pathogen, which is very likely? Now in anatomy, are they using the cats again? Anyone see the cats? Did your instructor ever pull out the mesentery of the intestines? And throughout all that mesentery, there's lymph nodes all over the place. Those are Peyer's patches. Those are meant to catch pathogens before, say, they get into your bloodstream. Not shown here, but your liver has Kupffer cells. Let's see, your spleen plays an immune function. People who contract mono, which is a virus, their spleen will enlarge. In fact, sometimes immune responses, your spleen will enlarge. You'll find that out. You can actually feel it because it's mounting an immune response, but you can live without a spleen. Your thymus, hey, case study. What immune cells mature in the thymus? T cells, okay? So we were talking about myasthenia gravis. And then let's see, tonsils, the dangly things in the back of your throat, your pharynx. They're also supposed to play a role in immune function of things that you inhale. Back in the respiratory system, there's alveolar macrophages inside your alveolar cells. And a macrophage, let me explain this. Macro means big and phage means to eat. They're big eater cells. They're literally immune cells that will consume through endocytosis any pathogen and destroy it. And so that's what those do. So those are some of our immune cells. So let's write a little bit about, see if my pen is on today. My pen on today? Wake up. Okay, so your bone marrow is where all your white blood cells, but I'm just going to put lymphocytes here, are produced. It's where B cells mature. B cells are a subset of lymphocytes. Lymphocytes include T cells and B cells. So in your bone marrow, that is where all your lymphocytes are produced along with other white blood cells, but the B cells mature there. Now the thymus is where T cells mature. We know a little bit about that from our lab. Lymph nodes, yeah, they activate lymphocytes. And that's fine. That's all I need to say. I could make it more complicated, but I'm not. The lymphatic vessels in your bloodstream circulate immune cells. So there's two ways immune cells. Usually your lymphatic system is where your lymphocytes circulate, lymphatic lymphocytes. But your blood vessels in your blood are the neutrophils, monocytes, some lymphocytes, basophils, eosinophils. Those are all floating around in your bloodstream. And that's great if the pathogen's in your blood. Not great if a pathogen's in your blood because you could become septic. But what happens if you get a pathogen gets into your skin, let's say, and it's not inside your blood? It's not inside a blood vessel. We're going to talk about how some white blood cells migrate out of your circulatory vessels into your tissue and mount an immune response there. It's important that they be able to escape your blood vessels. Tonsils protect from inhaled pathogens. And under this, I'm going to add alveolar macrophages. Also protect from inhaled pathogens, but in your alveolar sacs. Every place a pathogen can enter your body, there's probably a check. a bouncer at the door of your immune system. Your brain, God forbid something gets to your brain, you have specialized glial cells called microglia. Do you remember that from way back? They'll kill pathogens. I think we talked about 5 glial cells, and microglia were one of them. Your spleen, I'll just say, has immune function. All right. Your intestines have Peyer's patches. To protect from ingested, eat it, the pathogens. Your appendix over here, immune function. I'm going to keep it real simple. Just know that where they are. And then your liver has Kupffer, I think it's 2 F's, Kupffer cells for immune function. I'm keeping it very vague because I don't have to get into too much detail. In anatomy, while you're writing this down, do you learn about the hepatic portal system? Okay, you understand the significance of what the hepatic portal system is? Probably was way too far back, but it's actually really important. It's important in pharmacology because it's where ingested pharmacological drugs get a second pass after they're absorbed through your GI tract. They pass through and sometimes get activated at the liver. But anyway, so you're consuming the environment, you're eating it, drinking it, and it goes through your intestines. We now know if it's something simple, it can be in your bloodstream as soon as 30 minutes. So that stuff is passing across the membrane of your intestines into your bloodstream. Now that blood does not cycle right back to the heart through the venous system. Oh no, that would be very dangerous. Because what happens if the Peyer's patches didn't quite catch a pathogen and something got through into your bloodstream and went right to your heart? Now you have endocarditis, bad. Before all those absorbed nutrients and everything go back into the venous system and then pass through the heart, they pass through the liver first, which is your major organ for detoxifying and protecting you from things, okay? That's why the hepatic portal system is so important. The liver will detoxify everything, scrub everything up, and then kick it back into the venous system to return to your heart. So that's pretty important. And so the liver has immune function to catch anything that made it that far. All right. So that was a quick anatomy review of the immune system. Okay. Very busy slide. Everyone get to write it down? Okay. So now we're going to break down your innate immunity. This is the immunity that doesn't require anything special. This is kind of what you're born with. And it's actually the most complex part of the immune system people don't understand. That's what's saving you. When you're first exposed to a pathogen you've never seen before, like when people were exposed to COVID or any pathogen they've never seen, it's gonna take a good 2 or 3 weeks for you to produce antibodies against that. It takes your body time. That's why when you got the vaccine, like say I got the Pfizer, and 3 weeks after the first shot, you had to get your booster. And I don't know how Moderna went. I think it was also a 3-week period of time. And the reason you wait 3 weeks is you're not going to have a good antibody titer until about that time. And then you hit the immune system again, and it produces a lot of antibodies. But what happens in that 3 weeks while you're waiting for an effective level of antibodies to protect you? You're vulnerable. You ain't got no antibodies yet. Your innate immunity is what's going to protect you. And it's actually pretty darn good. It's not the best, but when you have nothing else and you're waiting for antibodies, you're going to rely on this to protect you. So external innate immunity. It's called non-specific because it's just a general protection. It is to keep pathogens out of the body. It's your barrier. All right, think of your skin. How many times do you have to wash your hands, right? Your skin gets all dry and everything like that. You've got all the hand wash stations and all that stuff. Is basically keep stuff from you touch the surface and you interact with your environment. And some things like COVID could live on surfaces. They're getting better at finding out how long. Let's say I'm not going to rub my eye. My eye is a portal of entry. You know, I'm eating lunch. Maybe flick my fingers. Oh, pathogens just got on my mouth. Okay. Or you have any cuts on your skin. That's a perfect place for stuff to get in. So your barriers are very important. We had to wear the mask, a barrier for inhaled substances getting into your body. So you are very familiar with this already because we've lived it for going on 3 years. Now, if something gets in, protection from pathogens that have gotten past the barrier. I'll say that enter the body. Through one of those ports of entry, eyes, mouth, nose, urethra, vaginal canal, anus. Although most people don't get infections there because, this is a weird way to start Monday morning lecture, is your colon, which is where the poop is becoming solidified, water is being removed. There's so much natural bacteria that live there that bad bacteria can't compete with it. You don't hear of many colon infections, do you? Because we have what's called a normal flora of bacteria that protect you. Even in the vagina, there's normal bacteria there. Micro people, we'll get to this. There's a bacteria that's a good bacteria that lives inside the vagina and it produces acid as a byproduct of its metabolism, and that keeps the vaginal tract acidic and protects you from bacteria. Do you remember what that bacteria is? It begins with an L. Lactobacillus. Okay. If you have a good population of good bacteria, it can keep the bad ones out. That's awesome. That's awesome. Okay. Now, once something's entered your body, this system I'm going to explain to you how it's protecting you. 2 or 3 weeks later after exposure, when something got into your body, then I'll even put here 2 to 3 weeks after exposure. Okay, that's important. It's going to take time. So you produce, I'll say produced antibodies for long-term protection. Long-term protection. You could have a vaccination, and sometimes, like I was rabies vaccinated when I worked at a vet clinic because it makes sense. You could be exposed to a rabid animal. And once I get my, I think it was a series of 3, just kind of like even COVID. And instead of giving you boosters, I think it was like every 10 years, almost like tetanus was every 10 years, no more than that. They could check your antibody titers to see if they're still high. Because some people are going to retain high antibody levels over time, and others it's going to wane. We're not cookie cutouts of each other. So sometimes that's done. All right. Sometimes antibodies can persist for a very long time. We used to think that the measles, mumps, rubella antibodies, when you got vaccinated when you're a baby, that would last for a lifetime. They're now finding out that in some people, those antibodies do come down. And measles is making a comeback. Anyone hear about that? Measles making a comeback? Ooh, you're going to encounter, and I'll talk about it in this chapter. Okay, I digress. So what are your barriers? Think about all the portals of entry into your body. So your skin, okay? Your skin is your biggest organ of defense. That's why we do it a lot now, but certainly as nurses in a hospital, you're going to be washing your hands, hopefully after every patient and all that stuff to not pass things on. Sweat is antimicrobial. Did you ever do in microbiology where you take a Petri plate and maybe it's got like E. coli and you basically just swab some sweat onto it and you look at the zone of inhibition that forms around it? Maybe with tears, maybe you did that too. Okay. So under I, since I said it, tears are antimicrobial. You ever think about it? I mean, when you are having allergies, which is the perfect time, the pollen is out right now. Why do your eyes water? It's your body's immune response to flushing out your eyes, which is a portal of entry for pathogens. Flush them out before they get in. Okay. Okay. Stomach acid. It's like a pH of 1 point something. Kills ingested bacteria. Okay. Bacteria do not like acidic environments. That's why your urine is acidic. Vaginal canal is acidic. Your stomach is acidic. That is all going to kill bacteria. They're not going to like acidic environments. Okay. Your respiratory tract, we have tonsils and alveolar macrophages. And I'll even put under alveolar macrophages, I'll say they eat and destroy pathogens. When I say eat, it's endocytosis. All right. And then urinary, genital, let's say vaginal, well, even urethra in a male. If urine passes through a urethra, it's acidic. And just by the acidic urine passing through the urethra, it's going to flush out any pathogens in the lower urinary tract, flush them out, and then it's acidic. And so it would kill anything that remained. So acidic, I'll say acidic tracts are antimicrobial. So your urethra is seeing acidic urine, and then the vaginal canal is acidic because of bacteria that live there. So bacteria don't like acid. And that works pretty well for keeping pathogens out, but they could get in. Okay. That's why I said, I forget, maybe I was talking about the urinary system. I was talking about the products being advertised to women, the douches, basically. All right. Women should not go crazy with that stuff. They shouldn't have to smell like a rose down there. The vaginal canal is a self-cleaning organ, and the lactobacillus bacteria that reside there, you don't want to flush them out or change the pH of the vagina with all these flowery things, because if you change it and flush out the good bacteria and shift the vaginal canal from being acidic to being alkaline, now you're going to be looking at a vaginal infection. So, just a little water and soap is fine. You're going to be talking to your patients about a lot of intimate things. So get over that now. Okay. Just be out and open with it. All right. Because they often need to hear these things. Okay. We good with writing all that down? Okay. All right. So let's talk about internal innate. All right. Things have gotten in. How do you protect the body without the aid of antibodies yet? So your external innate defense didn't work. Something got in. Now your internal innate is going to handle it. And we're going to start out with neutrophils and monocytes in your bloodstream. They phagocytize. They're phagocytes that eat and destroy a pathogen in your blood, if it's in your bloodstream. So they consume the pathogen, and then they have these little lysozymes, digestive enzymes inside the cell, and they'll destroy the pathogen. What happens if the pathogen's not in your bloodstream, but it's in your tissue? Now, monocytes, especially monocytes, can escape your bloodstream and get into your tissue. So the next step is, okay, so here is an actual white blood cell sucking in. Do it again. So this could be neutrophil sucking in endocytosis of a pathogen and then breaking it down with digestive lysozymes. That's what they do. They eat pathogens. But what happens if you get in the tissue? So starting with your white blood cells, basically your first responders are going to be neutrophils. If you see high neutrophils in someone's white blood cell count, they've got an infection brewing. Those are like the EMS of the immune system. They're first on the scene. Okay, here's what white blood cells like neutrophils and monocytes do. They secrete endogenous pyrogens. Have you ever heard that term before? Do you know what the word endogenous means? It means within. Anyone know what the word pyro means? Like a pyromaniac? What's the problem with a pyromaniac? They start fires. This endogenous pyrogens cause a fever, and the high, and I'm spelling it wrong on purpose to save space, temp kills bacteria. Now, you're going to encounter as future nurses a lot of people that have a kid or even them come in with a mild fever, like 100, maybe 101. They're still eating and drinking, they just kind of feel cruddy. And they're going to want immediately antibiotics. Depending on what they've been exposed to and how sick they're feeling, you want to let a fever kind of run its course because it's doing its job. So these endogenous pyrogens reset your hypothalamic temperature set point. Remember the anterior nucleus? It resets that temperature upper limit, so it allows a fever to happen. And that fever is inhospitable, high temp to bacteria, and that's your body's way of frying the bacteria. Now, a fever of 102, 103, 100, that you got to do something about. That's too hot. But 100, 101, take some Advil. All right. Let it run its course if it's not really causing someone to be very sick. All right. But that's what's happening. White blood cells cause your body temperature to rise by secreting this. Now, they also will send out a chemical cry for help. And those are called cytokines, C, and chemokines, C, are chemical cries for help. Now, your white blood cells can't go, help, help, other immune cells. We need a problem. We got a problem here. I need you to come here, stat. They can't do that, but they can secrete a chemical that is an attractant to other immune cells to come to the site. And so that's what these chemicals are, is they're a cry for help. And other cells, when they sense that, are going to migrate to that site where all the chemokines and cytokines are saturated, and they're going to go in for war. Now, so this is a cytokine cascade. And that's literally, it's come in contact with some bacteria, the little rod-like things, and it's sending out the chemical cries for help. It'll attract any other immune cells that are in the vicinity. Another cell other than white blood cells that's going to be part of innate immunity, natural killer cells. Now, they secrete interferon. Does interferon strike a memory? I've heard of interferons before. What did I hear that? I know I've heard that before. What's that word? Anyone? Do they give a chemical cocktail of interferons to AIDS patients? Yes, because they're good at fighting against viruses. Interferons are your body's natural antiviral chemical. It's going to basically attack viruses. That's what interferons do. Now, the toxic granules attack tumor and cancer cells. Basically, if one of your cells has become abnormal, and without getting complicated, they'll put these proteins on the surface of the cells that are abnormal, and your immune system says, I don't like the look of that protein on your surface. I think you've gone rogue. I'm going to attack you. And so that's what happens is any cells that become abnormal, like are reproducing abnormally through mitosis. Tumor cells are basically cells that are starting to grow out of control, but they're not cancerous yet, but they're abnormal. And so natural killer cells will throw these toxic granules at them to destroy those cells, hopefully before they become cancerous. Your body, believe it or not, not to scare you, I've learned a lot through cancer reading, you have tumor cells being produced in your body all the time. You have all these factors in your body that put out those fires before they become a problem. All right, we have anti-tumor genes and cells and all these things that are functioning in your body to squash those problems before they become cancerous. So here is, I guess, the toxic granules. All right, so just threw out the toxic granules and killed that tumor cell that's abnormal. I know this is kind of funny, but when I think of the immune system, I kind of think of a cartoonish type of thing. So you're going to see this theme throughout. It's hard to imagine things that are microscopic and you can't see unless you're looking at them microscopically. So I think of the immune system this way. It's just kind of funny. Okay, so here is the interferons, a natural killer cell secreting interferons. You know what viruses do? Really, really small, can't even really be sure that they're actually living things, but they hijack a normal cell and cause it to replicate more virus particles, virions. And when that cell is so packed with little virions, it explodes. And now you've got new virus cells all over. They look for the next host cell and replicate that way. Okay, so that's supposed to slow that down. And I'm looking at our time and we are running out. So we'll have to pick up the rest of it, which will be your inflammatory response. So Wednesday, we'll talk about your inflammatory response.